Welcome everyone to this webinar on whole systems approaches to diet and healthy weight in a digital world. My name is David Blane. I'm a GP and a clinical research fellow at the University of Glasgow. And I've been involved in Obesity Action Scotland, who are hosting this webinar since it was created. This is a particularly important topic. I'm really excited to be hosting it today and to welcome you all to this session. We know that obesity is complex. Some of you will be familiar with the 2007 Foresight report and its obesity systems map, the spaghetti map. I think for me that really kind of was one of the first times that I became really aware of the complexity of diet and physical activity, which are key drivers of our health as a population. Interestingly, that report also flagged and highlighted the interactions between obesity and the parallels with climate change and some of the challenges that are shared with relation to our food systems, our systems for being more physically active. We have 4 different speakers. Well, 4 different sessions. We are starting with an introduction to whole systems approaches. What do we mean by them? And in particular, how have they adapted in the last 18 months in the context of COVID to working more digitally. Then we will have a Q&A panel at the end, and if you have any questions, if you could direct them to specific people if possible, otherwise we'll kind of open it up to the whole panel. I will hand over now to our first speaker, who is Niamh Smith, who's the National Coordinator for Whole Systems Approaches to Diet and Healthy Weight for the 8 early adopter areas in Scotland.
Good morning, everyone. It's great to be here today, and it's great to have so many of you joining us. Thanks so much to David for chairing and introducing today's event. And as David said, today I'll be introducing Scotland's whole systems approach to diet and healthy weight early adopter programme. My name is Niamh Smith, and I'm the National Coordinator for Whole Systems Approaches for the early adopter areas in Scotland. And I'm based within Obesity Action Scotland, who are hosting today's webinar. I'm also undertaking a PhD at Glasgow Caledonian University, where I use systems approaches in my research. My presentation today will introduce us briefly to the world of whole systems approaches, and I aim to answer the following questions. Firstly, what evidence do we have for addressing obesity? Secondly, I'll introduce whole systems approaches and systems thinking as an alternative evidence base. Then I'll discuss the benefits of adopting a whole systems approach before sharing some useful tools to help us do this. And finally, I'll tell you about what's happening in Scotland. As David mentioned, if you have any questions as I go through, please add them to the chat and we'll aim to answer them at the end at the Q&A section. To frame today's presentation, I think it's really useful to draw your attention to these really alarming stats about overweight and obesity in Scotland. And the first stat is of particular interest, as this week is Action on Sugar Awareness Week, which focuses this year on how snacking contributes to our daily sugar consumption. And the other stats there, that 2 in 3 adults and 29% of children are overweight or obese in Scotland, are really quite stark. However, 91% of people surveyed in the Scottish Health Survey felt that fast food is too easily available. So there is this kind of will for change, a clear will for change in Scotland. I'll start off with a stock take of what the evidence tells us. And now this, the premise of this slide has been borrowed from a presentation I attended quite recently by Harry Rutter, a professor of global public health and excuse me, and a big advocate for systems thinking and systems approaches. He recently described the evidence around obesity and other public health issues as a dangerous olive stuffed with peppers and garlic. And I tried to give it a bit of a different feel as a Scotch egg, which gained a bit of popularity last year following the controversy over it being a meal or a snack in the pub in our COVID era. Here, the sausage meat represents all of the things that you could possibly do about obesity. So all of the possible interventions that we could try. And the egg white then is the subset of these interventions, which have been studied and for which there is evidence of their effectiveness. Within the evidence for the effective obesity interventions, we have only a comparatively tiny amount of evidence for the cost effectiveness, and that's the egg yolk in this case. And with tight budgets, it's no wonder that we rely on interventions at this that we have evidence for, so as it makes sense to go with what the evidence tells us and what the science says. Now, what type of interventions do we have evidence for, and what type of interventions do we have cost-effective evidence for? So what types of interventions are included in this egg? This diagram on the left is from a paper in The Lancet in 2011, and it highlights that the evidence base that we do have for the effectiveness and cost-effectiveness, so the egg part of our Scotch egg, is based on studies at an individual physiological level. Now, from a research perspective, individual interventions are far more straightforward to carry out and evaluate. For example, we can quite easily set up a study to measure the impact of particular drugs or programs or different types of surgery for an individual. And with the evidence centred around this, it makes sense that decisions are then based on that evidence. However, other interventions, so the sausage meat, are under-researched, as really it's far more difficult to do a study where you evaluate the impact of these big overarching systemic drivers. For example, David mentioned our food systems and things like our consumption patterns, the impact of different policies, and the environment, the impacts of our environment on our health as well. These are just much harder to measure. And what we can see from the diagram, though, that it's these big changes that actually affect at a population level and have these big changes that we really need to see. So there's our little individualized egg. Similarly, this is a more recent model, and specifically for obesity, and it highlights the discrepancy, the mismatch between the causes of obesity and the interventions and the actions that take place. So on the left, we have the wider determinants of health model, and Nobles et al. Counted the number of causes of obesity within each colour of this rainbow. So within the wider conditions that affect obesity, the living and working conditions, the social and community factors that play a part, the individual lifestyle factors, as well as the biological, physiological factors. And on the right, they counted all of the actions that are taking place in 10 local authorities across England. And as you can see there, that although there is a lot of environmental factors contributing to obesity, the actions that we take based on the evidence we have from the previous slide centre around the individual lifestyle factors. So we really need a change, a shift in actions taken to address obesity. So we've seen evidence and actions centering around individual behaviours. But how can we move away from this, and what's the alternative? An alternative way of working is to use a whole systems approach to inform actions. And in Scotland, a whole systems approach to public health is defined as an ongoing, flexible approach by a broad range of stakeholders to identify and understand current and emerging public health issues like obesity, where by working together, we can deliver sustainable change and better lives for the people of Scotland. Our national partners, along with other stakeholders, developed a set of 9 characteristics of whole systems working, with partners across the system, building on learning from others, including the work that Leeds Beckett and Public Health England produced. Firstly, systems thinking. This is a change in the way of thinking about a problem, and I'll talk a little bit more about that in a bit. We want to establish creative and innovative working environments where there is a learning culture and where future actions are continually shaped by what has gone before, and we are reflexive in the approaches we take. Sustainable collaboration and collaborative leadership are also key in facilitating a whole systems approach. Purposeful engagement from a wide variety of stakeholders and recognising that place is important and that whole systems approaches will be really different across different contexts is also really important. Additionally, a secure governance and resourcing is needed to ensure that projects are sustainable. And finally, a whole systems approach works towards a shared vision which unites the stakeholders with different backgrounds and agendas to form a common aspiration. And that's a clear vision which allows stakeholders to stay focused and move forward in the same direction, helping everyone see how their work fits together. And you'll hear examples of all of these from the next speakers. So our 8 early adopter areas, which I'll introduce you to in a little bit, they were provided with training on the Leeds Beckett University's guidance for adopting whole systems approaches to obesity. And although this training was provided, areas were encouraged to use this as guidance rather than a prescribed method that had to be followed. And the guide describes a how-to process from engaging senior leaders and wider stakeholders to conducting systems mapping and then action planning, and then reviewing and adapting the approach for future use. The approach also isn't about starting from scratch, rather it's about taking stock and recognising what is working locally, while also looking at what could be adjusted and added to improve the system. As well as the training provided by Leeds Beckett to go along with their guidance documentation from Public Health England, there's also a number of other resources. So if this kind of systems thinking, systems approaches is new to you, there's courses online at this Acumen website, which is a systems practice course and is free, and also the Open University have a number of different systems thinking courses too, which are free. So as I mentioned, systems thinking is a really key part of this systems approach work. Some of us may be familiar with the fable about 6 blind men who come across an elephant for the first time in their lives, and they try to work out what it is by touching different parts of the elephant. And all of the men come to feel a different part of the elephant, leading to a complete disagreement on what an elephant actually is. So one feels the tail and it feels like a rope. One the leg as a tree trunk, the body of the elephant feels like a wall, the ear of the elephant feels like a fan, the trunk feels like a snake, and the tusks feel like a spear. And such interpretations are derived from their personal experiences and their understanding of the world. And these are called mental models within the systems literature. Now, independently, each of the parts of the elephant can be confusing, and people's interpretations can be wide-ranging based on these mental models. What systems thinking allows us is to better understand the men's perspectives and allows us to take a step back and see how all of the parts fit together as one. We think inquisitively about things and we try to understand where others are coming from. This is what we're doing with looking at diet and healthy weight as a system. There are a whole host of different factors that lead to high levels of overweight and obesity, and we must try to understand them all to understand the big picture of the obesogenic system. So what are the benefits of adopting this type of approach? Firstly, the effect of collective action is greater than the sum of the individual actions, and the whole systems approach identifies, implements, and aligns actions that have a wider impact across the local system at a population level. So we're seeing the whole elephant. As well, taking a whole systems approach maximises all of the assets in the local area and recognises and works with the strengths of a community. It supports a community-centred approach to reducing health inequalities, which involves local communities and therefore better reflects the local context. The approach develops transferable workforce system thinking skills and capacity, which are relevant and applicable to other complex issues, for example, homelessness or the attainment gap, and loads of different issues could be studied using this kind of systems thinking and systems approach. It also recognises the potential of all partners that can contribute collaboratively, including NHS organisations, local authority, education, business, voluntary sector and community members. And finally, the changes implemented through using a whole systems approach may have cascade impacts while creating healthier environments. We may also see changes in other issues like, for example, reduction in litter or a change in antisocial behaviour. So what tools can we use to help us with this process? Systems mapping is seen as a key visual tool that can be used to encourage systems thinking. Through the course of a number of workshops with stakeholders, local areas ask participants to identify all of the causes of obesity in their communities. Then they look at how these are connected and they create these systems maps. And David mentioned the foresight map, which was one of the first of these in 2007, the kind of spaghetti diagram. These are others that have been created more locally. And it looks at how all of these different factors are connected and how this creates the system of the local obesogenic system. They then discuss ways to leverage change, looking at what's already happening locally, but also looking at new actions that could be implemented. And we're really looking for small changes at lots of different parts of the system that can then have a ripple effect throughout. And so the benefits then are they provide a visual representation of the big picture. We see the full elephant, we see all of the different parts. They are also useful for encouraging systems thinking among stakeholders. They allow for discussion about where to make changes. As they're created from multiple perspectives, it gives community members and all of the stakeholders that took part a sense of ownership, which hopefully leads to buy-in throughout the process then. And finally, the mapping allows us to uncover potentially unintended consequences. So things that we may not have thought would happen as a result of a particular action. And this can help us with planning for future actions. So finally, what's happening in Scotland? So 8 local authority areas were selected as early adopters of a whole systems approach in 2019. And these include North Ayrshire, Dumfries and Galloway, Dundee, and then 5 areas which come under the East region of Scotland, which are Fife, East Lothian, Borders, Mid Lothian and West Lothian. And the areas in bold here are areas that you'll be hearing from today. The areas are supported by a group of national partners consisting of the Scottish Government, Food Standards Scotland, Public Health Scotland and Obesity Action Scotland. In addition, my role as a national coordinator works between the early adopter areas and the national partners, providing support and learning opportunities to the early adopter areas and also then reporting back to the national partners. The whole systems approach work is being evaluated nationally through a process evaluation. And there are 2 research evaluations taking place in Dundee and another in Mid Lothian and West Lothian too, all of which will inform the future of whole systems approach working in Scotland. Each area is embracing the change in working patterns and all have had really unique experiences to date. And we propose that through adopting a whole systems approach, areas will understand the drivers of poor diet and unhealthy weight in their communities. They'll also begin to understand what levers can be pulled to change the system. They'll evidence leadership and commitment at all levels of the different organisations. They will evidence new collaborative working patterns, breaking down the silos and working collegiately, both locally, but also with the national partners. And finally, learning from the early adopter areas will inform the future of whole systems approach working across Scotland. Now, the last couple of years have brought about significant change in the way of working for everyone, I'm sure, on this call, and the early adopter areas are no different. We are so lucky to be joined by the leads from 3 early adopter areas today, who will share their experiences of whole systems approach working to date. That brings me to the end of my presentation. Thanks so much for your time today.
Thank you, Niamh. That was fantastic. Really clear overview not just of whole systems approaches, but specifically to the context for the rest of the sessions with the early adopter sites. So I would now like to move on to the first of those early adopter presentations, and this is from Laura Gunning and Holly Macdonald, who are environmental health officers in East Lothian.
Thank you. Good morning, everyone. So I'm Laura Gunning, and I'm just going to talk to you with my colleague Holly Macdonald a little bit about our project Loving Life at Musselburgh, and it's very much centred on improving health and well-being in Musselburgh using this new whole systems approach. So I'd like to take you through a few areas here today. Firstly, who we are and where we are for the project. Why we think that our project is a little bit unique. Holly, who joined the project more recently, will talk to you about what it's like joining as a new start into the whole systems project. We'll go through a little bit on our feedback from the Public Health England Toolkit and the Leeds Beckett University training that we went through. Talk to you a little bit about workshop 1, which we ran in fact a week today, so it's still very recent. And then a little bit about the next steps that we plan to take with our project. So I'll hand over to Holly, and she'll talk to you about who we are and where we are.
Yeah, so exciting. So this is us two in the office. So we are environmental health officers, and we work in the food and health and safety team. So this work is very different to what we normally do on a daily basis. So 10 points if you can spot a lobster in the background of this photo. So yeah, it's very, very different for us, and we just wanted to capture a moment when we had our Loving Life invitations that we passed around the community. So yeah, this is us, and we're really excited to talk to you about our project. And on the next slide, just some information about where we are, because you might be watching this and be like, I've never heard of East Lothian. So we are just outside of Edinburgh, and we are a rural authority, and our project is specifically based in Musselburgh. And on the right-hand side of the right-hand side photo is the current deprivation index for Musselburgh. So you can see there's some quite big differences in quite a small town, quite a small area, and unfortunately it's got worse since in the past 2 years. So yeah, so we're a rural authority, and Musselburgh kind of spreads out from Edinburgh, so there's always that risk of it kind of losing our identity. So on the next slide, we've got some photos of Musselburgh looking great. We've got some nice sunsets, we've got a lovely harbour, and just some kind of like really like beautiful parts of quite a diverse town. So hopefully you like the sunsets. So moving on to the key facts about Musselburgh. So Musselburgh is our biggest population in East Lothian, so it's 20%, so it's quite a big chunk. However, it's a very small geographical town, so it's very densely populated, which means there's quite a lot of there's a lot of wealth. There's a lot of there's lots of changes in wealth, and we've got some extreme earners. We've got a lot of people on income benefits. So it's quite an interesting picture. We've also got a really high level of free school lunches, and quite high levels of obesity through all age demographics. We're specifically based our project in East Musselburgh because that's the most deprived part of Musselburgh, which was kind of the red and amber bit on the map. So that's kind of setting the scene of Musselburgh. So I'll hand back to Laura.
Thanks, Holly. So every project is unique, but we thought we'd pick out the 3 key reasons why we feel that Loving Life is unique. The first one is that it's being led by ourselves in environmental health. So environmental health has had a huge part to do with public health for over 130 years. And one of the first key bits we had was the Public Health Scotland Act back in 1897. And in those days, we were known as sanitary inspectors. And we had three core parts to our remit. We looked at poor, overcrowded housing, polluted water supplies, and contaminated food. But since then, things have moved on a lot and our remit's got a lot wider. So the sorts of things we get involved now is we're involved in the food agenda. We do hygiene inspections of food premises. We look at food standards, and that's things like the labelling and the composition quality of the food. There are foodborne illness investigations. We have food complaints. We regularly do sampling. And of course, we offer a lot of guidance to our food businesses. Private water supplies, that's still a really big part of what we do. And we're often climbing the hills to some quite remote places, looking for water sources and water tanks. And this one pictured here is very recent. It's just a couple of weeks ago, we had an E. coli 0157 contamination event, unfortunately with a couple of linked cases. Recently, we were authorised under the health protection coronavirus regulations and all the various updates as we went through the pandemic. And we've had a big role there. Our key areas have been looking at social distancing in premises, all the premises restrictions. We've had a role in contact tracing. A big part of what we've done is event safety advisory groups, dealing with public queries, and again, helping with business support through the pandemic. And Brexit has also brought new part to our role as well. We've been putting on our life jackets and boarding fishing vessels to do inspections. We've been the centre at all the exports and imports paperwork for food parcels. And again, we've offered as much business support as we have possibly been able to do. But that's not it. There's also a key thing is licensing. So we have things like horse riding, establishment licenses, tattoo licenses, skin piercing, public entertainment licenses. We are a statutory consultee for planning applications, so we often make comment on those from a public health perspective. We look at housing standards and landlord registrations. Health and safety, we often do topical interventions here, and unfortunately when there are accidents, we play a key role in investigating a lot of those. We look at air quality, and we have a national air quality network. We look at contaminated land. We do infectious disease investigations and a whole range of public health nuisance. So I think the key message that we have here is that environmental public health is well set up with a clear regulatory framework, and we have great community connections. And for some time, we've had this holistic approach to public health, which is similar to the whole systems approach. The second reason why we think we're unique is that we've engaged with the Democratic Society. So we did this when coronavirus came along, and we had to change our plans from delivering engagement workshops in person. And the Democratic Society are based upon the principle of building a democratic infrastructure that allows people to be involved in decisions that shape their life. So our project sat very well with them, and they were a really good partner to engage with. They offered us an online software appraisal, and we ended up choosing to use Zoom and another software called Miro. They gave training to our facilitators, because for a lot of people, we haven't done online facilitation before. So that's a key skill that we all have. And they actually helped us on the day as well to co-host the workshop. So we knew if there was a technical problem that they would have that covered. So ultimately, I feel that it created a really comfortable online space, a space that was conducive for people to feel that they could contribute. And the final reason we feel that we're quite unique is that we've gone for a town-specific approach. And Holly's identified a few of the reasons why we chose Musselburgh. But the reason we decided to choose a town is we wanted to do a community cross-section rather than focusing on, for example, child healthy weight. And to do that, we felt we needed to be quite specific geographically. We also wanted to tap into existing town networks and the shared goals that we already have in a town community. And we are already considering, though, about expanding the project and maybe doing other towns at a later date. So I'll hand over to Holly, and she's going to talk to you about what it was like to join the project sort of further down the line.
I just wanted to kind of remind you all that whatever stage of your career you're in, or however long you've been in a role, that you can do new things. So I just recently started at East Lothian. It was July. I came on board, but I'm friends with Laura outside of work. Very grateful. And I remember her telling me about this project back in November 2020, and at the time I was actually living in East Musselburgh. I remember thinking, my gosh, that would just be so life-changing if I could kind of be involved in that as a resident. And I am plus size. I'm quite active in the plus size community locally. And when I was asked to kind of if I wanted to be involved in the project, when I started, I like jumped at the opportunity. So I think sometimes it's really important to have really good representation, especially when it comes to just kind of getting the language right for just kind of using the word abuse. I think sometimes you have to be quite careful not to scare people off. So it's just a quick photo of me when I first moved to Scotland in Musselburgh. And I just wanted to, on the next slide, I just kind of also want to remind you that sometimes if you sit back and like don't take these opportunities, then who will? And I think working on a whole systems approach, it's so important that it doesn't become a tick box exercise. It's something more than that, because we have to always remember our target demographic who are going to be impacted by this, and some of these people have kind of been left behind, and it's just so important that we just think of them and like how we can impact and hopefully like make their lives just a tiny little bit better. And also just a kind of reminder that if you start a new job, start a new project, it's okay if you don't know technical language. Like, it's absolutely okay, because sometimes you've got to study like Hermione Granger, and if you're watching this webinar, you'll know you can like learn new things really quickly. So just a bit of you can do this, push yourself out your comfort zone and just give it a go, bring your enthusiasm, because people who have been working on these projects for a long time really need that support. So I'll hand back to Laura.
Thanks, Holly. That's great. So we just thought we'd say a few things about how we found the Public Health England Toolkit and the Leeds Beckett University training. So there were lots of positives. I went along for the training sessions, and the best thing I found about it was the networking. It was a great opportunity to meet the other leads from the other projects, just to share common experiences. And it was really interesting. It was something, as we've said, that's very new to our roles in environmental health, but at the same time, very relevant to things that we already do. I think if we were asked to give some feedback, we'd say that we found the toolkit a little bit too comprehensive. It was very academic, and as a result, the language wasn't perhaps always centered to a community level approach. So what we decided to do was to strip it right back. I know that Holly's going to talk a little bit about the mapping and how we adapted that, because we found that a little bit too complicated, and we would do that differently next time. However, we couldn't help but include the great video. There's a video on YouTube called The Cats of Borneo, and it's all about unintended consequences. We found that really great. So I'll hand to Holly, and she's going to talk you through our experience of workshop 1 last week.
Yeah, so I can't believe it's a week ago today, which feels crazy, and it's really nice to kind of like be kind of like talking about it when it's so soon. So we made the decision very early on to really cut down a lot of the theory, because we knew that we'd found it quite hard to kind of engage the community. So we were like, right, let's just make this as kind of like conversation led as much as possible. So we really took down a lot of the theory, and we removed activity 1 from the Leeds Beckett guidance, just because we didn't really think it really kind of added to, it wasn't really that pertinent to the main objective. So we used Zoom because it's free to download, it's quite easy. And it was really great because we had such a cross section of the community involved, and that was because we were kind of out walking the streets with some like a hard copy invitation, because I think we found it quite hard to engage just through an invite on like using Outlook. Unfortunately, we had quite a lot of a high number of apologies on the day, which was a bit of a shame, but we had 20 participants. So we just kind of went with it, and we had a great time. We had such a good time that we found it really hard to get people to stop talking. So I think that's quite a good sign that it was that everyone who attended was really passionate. I think it's quite rare to be in that situation where you're like, okay, we hear your opinions, that's great. And on the next slide, we've got some kind of specific learning points for us. Personally, we decided that we wouldn't use the Leeds-Beckett same and opposite because it took away from the discussion that groups were having, because they were like too focused on, well, what is that same or is it opposite, rather than kind of moving on to the next point. And because we'd reduced the event so much, we were like, we really needed it to be quite fast paced. And we also found it quite hard, note takers remaining neutral, because what happened is that actually changed the conversation that they were having, so it wasn't a good reflection. And we would have, we would make little like prompt cards for our group leads, because I think sometimes it's quite weird when you have an awkward silence, but actually that's really normal, and especially when someone's quite new to, someone's never done anything like this before. So we try and be like, it's okay if it's quiet, it's absolutely fine. And I think something for us that we thought went really well was having a discussion lead and a note taker. I've put that wrong on the slide, I just noticed that, I'm really sorry. So yeah, having a discussion lead and a note taker, it just means that the discussion lead can be really focused on really engaging in the conversation, make sure it's moving in the right direction. The note taker can just get a really good sample of that conversation. So we had a really good time, and I thought it went really well. So I think that's yeah, glad it's done.
Thanks, Holly. So just to briefly talk a little bit about the next steps that we have in line for our Loving Life project. So we are in the process of holding some debriefs, verifying our content from the workshop to make sure that we understand the points that people have made, and we're also always in the process of growing our stakeholder base. So we've already heard from a few people through word of mouth from workshop 1 that would like to now join the process, which is fantastic. And these causal maps that we created, we have around sort of 12 quite detailed maps. We're now in the process of collating those using another software, which will generate our Musselburgh obesity map, which will look similar to the ones that Niamh showed us earlier on, but it'll be specific to our Musselburgh community. That's all in advance of our second and final workshop, which is where we will actually, as a community, jointly formulate our action plan. And to do that, we will start with our Musselburgh obesity map, and we'll look at points at which we could maybe tweak things or leverage points, bearing in mind all the great things that are already happening in Musselburgh, which we would like to tie in with, just to put together a really effective action plan that the community will be brought into helping us to implement. So following that, we'll then share our action plan. We're already looking at reviewing our working group, Holly and I. I've got a few people in mind who are so passionate about what we're doing, and they're members of the community, and we think it would just be amazing to have some community members be part of the working group. And we always hoped that we would engage with these people, and this would sort of naturally happen. And so we're really lucky to be at that point where we feel we can make that happen. And as I mentioned earlier, we're already considering at a later point duplicating this sort of exercise across East Lothian. But ultimately, the key things that we have is that we're very much a community-led project, and we feel that is the key to delivering sustainable change. So we're really excited because we don't know exactly what direction it's going to go in. It's completely dictated by the community partners that are involved. So it's great to be part of Loving Life, and it's great to have told you a bit more about it. And thanks to Niamh.
Yeah, thank you, everyone. I just wanted to add something really quickly. We knew it was going to be a bit, it might kind of go in like rogue discussions. So just go with the flow. If you have some really weird discussions, just because we have no idea how it's going to go. So yeah, thank you.
That's great. Thank you, Laura and Holly. Really, really interesting presentation there. No, also just to flag the some of the elements from Laura and Holly's talk in relation to community engagement and how they went about that. I think I would again encourage you to revisit the webinar from last year, which was all about different approaches to engagement, and is worth checking out. Okay, on that note, let's move on to our next speaker, who is Penny Oliver. Penny is a health improvement specialist working in the Scottish Borders, so just a bit further south from East Lothian. Over to you, Penny.
So hi everybody, it's lovely to be invited to take part in this webinar, so thank you for the invitation. It's a really good opportunity for us to share the work that we're doing in the Scottish Borders. We feel like we've been working on this for quite some time now, and there's been a lot of really good work happening in Borders, so yeah, really great to share it with you all today. So my name is Penny Oliver, and I'm a health improvement specialist. I work with the Joint Health Improvement Team, which sits within public health in NHS Borders. And I'm also the operational lead for Whole Systems Approach. So we've got a couple of leads locally, but it's just me that you have today presenting, and I will be joined by a colleague, Fiona Doig, later on to answer any questions. Okay, so just to give you a little bit of an overview about what I wanted to cover today. It was just to give you an introduction to Eyemouth, really, just to give a little bit of background about the area, and also just to cover our community-led approach. We wanted to share with you the structures that we've put in place, the steps that we've taken so far. We wanted to cover a little bit about how we've engaged with our stakeholders, and obviously we will be sort of covering the challenges in a post-COVID world of how that has happened for us locally, and then just to share with you a little bit about our action plan, how that's looking at the minute, and the stage that we're at. Okay, so this is just to give you a little bit of an oversight of Eyemouth. So yeah, we're a town on the Berwickshire coast. Our population, as you can see there, is 3,500. Eyemouth is, thinking about its geography, it's situated about 9 miles north of Berwick upon Tweed, and anybody that isn't familiar with this area, just to let you know that Berwick is in England and Eyemouth is in Scotland, in the Scottish Borders, so we're very close to the English border. I think speaking to people in the Eyemouth area, because of where they are in the borders, they're sort of tucked right over on the east coast. There is a feeling that they may be slightly detached from the rest of the Scottish Borders. You know, traditionally a lot of our services, and particularly health services, are based within Central Borders, which is quite some distance from Eyemouth, and transport has always been an issue for people in Berwickshire, including Eyemouth. So Transport Links, our third sector interface partners, BAVs, have been doing a lot of work recently to try and support that, introduce different kinds of transport options for people away from the traditional sort of bus services that very few people are using but are required. So yeah, so there's a lot of work has been happening to try and find solutions to the transport issues, and also we've done a lot of work in the past in health improvement around food accessibility, food availability. We know from community research that we've done in the past that a lot of people, despite living in Eyemouth, they may work in Berwick, or if they have access to transport, they will go to Berwick to use the local supermarkets to buy their food from the English side of the borders, which for us, in terms of some of the public health priorities that we have, or just some of the messages or the guidelines through COVID, can be quite problematic. So in terms of minimum unit pricing for alcohol, we know that people tend to shop on the English side of the border, so that's quite an interesting one. And also in terms of the COVID guidelines and restrictions, it was probably quite sort of complicated for people around that sort of area when they're living and working, shopping on different sides of the borders, and possibly kind of moving from England to Scotland on a daily basis. So it's an interesting area to work in. The tourism opportunities in Eyemouth are increasing. You'll see from the photograph there, we've got a beautiful picture of Eyemouth. It's sunset. Sunsets seem to be a theme for today. This was taken by one of our local community members. Eyemouth is known as being, within a beautiful coastline area. That's Gunn's Greenhouse in the back there, which is known for its history of smuggling, where the coastline is a marine reserve. We have a nature reserve. It's a very beautiful area. And I don't know if we have any Marvel fans in the webinar today, but some of you may have recognised St. Abbs as a name that was used in the Avengers Endgame as I think it was New Asgard, which is Thor's hometown. So it's part of, there's a lot of regeneration work happening. There's a lot of tourism, which does impact on the work that we do around whole systems because of the out-of-home sort of food providers that we have. We have a lot of good restaurants and fish and chip takeaways and that kind of thing. There are good established partnerships in Eyemouth. As mentioned, we've done quite a bit of work in the past around food accessibility and food availability. But what I would say is Berwickshire in particular, as part of the Scottish borders, has some really good established collaborative partnerships that include community members, community groups, our public sector partners, just right across the board, and third sector interface. We do obviously have inequalities within this area as well. So we know that child poverty is a growing concern right across the board in Scotland. We also have one of the sort of indicators that stands out is our P1 dental health. Early deaths from coronary heart disease. There are other indicators as well, but really don't want to dwell on that too much. But Eyemouth was it was identified as an area for the whole systems approach project because of the sort of positive partnership work that's happening, but also because of the inequalities that we know exist. And the rurality is part of that. We know that for somebody in Eyemouth to get to a hospital appointment and back using public transport will take them all day. There will sort of the health sort of service, it's difficult for people to get to some appointments. We are an ageing population in the borders, and there's also quite a lot of work has been happening around digital inclusion. So in terms of what's happened through COVID and everybody moving to online delivery, we knew that would be quite a challenge. there have been a number of different schemes like tablet lending, and you know, we've had community partners that have done some good work around bringing in some funding for you know, to distribute tablets to families or to older people, just to try and encourage that digital inclusion. Okay, so the Eyemouth pilot, as mentioned, you know, we have taken a community-led approach to that, and I think that has built on work that we've done in the past amongst the partners that have been working in Eyemouth for a number of years now. We've had some really sort of successful examples of previous work that we've done in Eyemouth in terms of that community-led approach. I just wanted to sort of point out at this stage that my post pre-COVID, I would be based in Eyemouth Community Centre for 2 days a week, alongside colleagues from Community Learning and Development Service and our district, Eyemouth and District Community Trust, the Splash Project. So we were co-located in an office in Eyemouth Community Centre, which is, you know, has really proved its worth in terms of taking forward the whole systems approach. We've worked with a lot of community partners in the past. We've designed, developed, delivered health improvement programs. You know, we've done a lot of co-production work to develop and build community action plans with our volunteers, with our community partners. We've used participatory appraisal methods in the past, and that's, you know, just some examples of that was, you know, we developed an Eyemouth Good Food Partnership. We've developed things like tea dances and other sort of events and projects with the primary school that have then sort of been, you know, moved forward and developed being community-led. And we've got a really good project called Links Eyemouth, which has gone from strength to strength, which was really a sort of local mum who really took on the healthy eating agenda, and now has a closed Facebook group with a following of over 300 members, sorry, as part of that. So we've had some really good examples of that in the past, and I think you know, we've been able to sort of utilise that in terms of taking forward our whole systems approach. So we had, just going back to pre-COVID, we were starting to develop structures. We had those in place. I think there'd been some training that had happened. There'd been a stakeholder, more of a strategic stakeholder event. The local leads had been identified, and I think that was really the stage that we got to when COVID hit. So obviously that's kind of turned things on its head in terms of how we've been able to take the work forward. The community centre, which was our base, was turned into a massive food distribution site with resilience groups and the likes working from there. We've obviously moved to homework, and in terms of engaging communities, and you know, anybody that does that kind of work will sort of understand that really to get the flip charts out and the markers and do things like that is the desired way to do things. It has been it's been a challenge to move to the digital world. We've had some real, there's pros and cons, there's been some real benefits from it, but it's also been quite challenging, which I'll go into in the presentation. Our working group, there was, you know, certainly a few of us that were deployed to doing COVID response work. So once we'd returned, we were able to really form our working group in January of this year. And I think once we started to do that, the timescales became quite apparent that, you know, we were going to have to sort of make some progress fairly rapidly. So our timescales at that point were that we would deliver 2 workshops by April, with to give the actions, form the action plan, time to develop so that they could be evaluated and work to the end date of the project, which at the minute I think stands at April 2022. So we sort of quickly sprung into action. This is just to give you an idea of our structures. So we have our governance group and we have our working group. So our governance group is chaired by the Service Director for Customers and Communities. The meetings are via MS Teams and every 6 weeks. They are quite flexible and responsive to our needs. So if, at every meeting we're really asked, what's the next stage? Do we need, when do we need to meet? Does it need to be quicker than 6 weeks, or does it need to be, can it wait for, 6 weeks time? The membership is really sort of more strategic, sort of colleagues from NHS Borders, Scottish Borders Council, Live Borders. And as I say, they're really quite supportive to us. Our working group, so once we sort of formed in January or just before January, we're really sort of having that, that thinking about who do we want to have as part of our working group. It's myself that chairs that group. And we really wanted to have people on the working group that were able to actually do the work. We thought it was maybe going to be a little bit of a stretch to ask volunteers to come on board in terms of being on that particular group, because we knew that we had tight timescales and we had a lot of work to do. So our membership is there's joint health improvement team. So there's myself, there's project support, and we've just recently gained a colleague who's a health improvement practitioner to support with that work. We have Scottish Borders Council Community Learning and Development Service and colleagues who are also doing the community assistance hubs and have really good links with the community. Until recently, we had Early Years Centre, and hopefully that will continue. We've just, our staff members moved on to a different post. So unfortunately, we've just lost her. And then we have Eyemouth and District Community Trust, which is the Splash project. And I think in terms of how we've moved to home working, that's been really a vital kind of link to the work in the community, because our manager from the Splash project has still been fairly active with the volunteers, with the other community groups through the sort of the COVID response and the food provision and links with the larder and the community fridge and that kind of thing. And then we also have our Live Borders Active Schools coordinator, who's really well linked in with the local community, grew up in Eyemouth and just has really sort of good links there. Okay, so what we did was we tried to follow we followed the Leeds Beckett toolkit quite closely. We have adapted some of the way that we've done the work, obviously because of COVID. So the network analysis, which was really trying to find out what stakeholders should be involved in the whole systems approach, because of the existing partnerships that we had through the members of the working group and the work that they had been involved in, we had a pretty good overview of the people that needed to be involved and included as stakeholders. So, time was of the essence at that point. We really didn't kind of have too much time to be sending out letters or emailing people out for them to then identify others in the network. So we did that fairly quickly as a group, and then we also engaged with our community members or volunteers to find out who else wanted to be involved at that stage. And I think our stakeholder sort of network it's just evolved and developed as we go along. I think we're currently at about 97 people on that list, and some and we've communicated regularly with them via email. The next stage was our action mapping. So we really wanted to find out, our focus was on supporting healthy weight, eating well and being physically active, with a focus on health inequalities and children. So we wanted to find out what activity was already happening in the community. We were aware of quite a lot of that activity, but we developed an MS Forms questionnaire, and that was circulated to all of the stakeholders. We had 24 respondents. It was a bit of a mixed initial response. It was quite interesting actually, because we did quite a few follow-up conversations with people just to say, did you receive the questionnaire? Are you able to fill it in? We did actually have to make the links with some. So for example, things like financial inclusion, they didn't maybe necessarily relate the work that they were doing to whole systems approach, sort of tackling overweight and obesity. So it was very much about, once we'd sent the questionnaire out, we really needed to do those follow-up conversations. And that gave us a baseline that we mapped. The next slide, it was good to see Niamh's representation of this in her presentation, but it is a process that we will repeat. So what we ended up with was the action map, which is mapped against the social determinants of health. And what we did was we mapped our current actions, which is at the bottom there in green. So they were taken from the responses from the stakeholders, and we gained some support from our analyst to really sort of put that into this model. And then we had our current causes, which we mapped from all of the things that had been identified at workshop 1. So one of the exercises at workshop 1 is around what are the current causes of overweight or obesity. So this is what we ended up with here. So you can kind of see the similarities to what Niamh was explaining in her presentation. Just give you a little bit of an overview here about workshop 1 and workshop 2. So we did do them fairly differently. Workshop 1, the aim was to collaboratively form an understanding of the issue in the context and the wider system. We delivered that on Zoom. We did follow the Leeds-Beckett methodology and the session outline. So it was a 3-hour workshop, and that was delivered on the 31st of March. We had 42 participants at that, and that was including our presenters, and we created our causal maps. Similarly to what Laura and Holly were talking about, people really wanted to talk. There was a little bit of feedback about there was too much about the causal maps. Anybody that's familiar with them, with the O's and the S's and the arrows and that kind of thing. But despite the fact that we thought we had incorporated, a fair bit of time for discussion, people still wanted more. It was definitely something that people wanted to talk about. There was also feedback that 3 hours was just quite a significant amount of time, particularly for sort of community partners and community members. So for the second workshop, which we held 4 weeks later, we wanted to keep the momentum going, so we did that pretty quickly. And the platform for that one, we had to move to MS Teams. There was that whole discussion about Zoom versus Teams. We know that Zoom is a platform preferred by community members, but MS Teams, because of some of the security around Zoom in particular, for NHS and local authority, MS Teams is the preferred platform. So we moved to MS Teams. Whether that had an impact on our drop-in participants, I'm not quite sure. I know that there were a few people who struggled to get on to MS Teams, or once they were on, dropped out. But we cut that workshop back to 2 hours just to try and make things slightly easier, and we did adapt from the session outline that was recommended by Leeds Beckett. We cut out a lot of the theory. We had more time for people to talk, and at the end of that workshop we'd identified 3 priority themes. What I would say is that tech support is probably essential for these kind of sessions, and I would absolutely recommend having somebody there to just concentrate on that. Our stakeholder engagement, just to sort of summarise what we've done. So especially during phase 3, which was mapping the local system, we had regular email contact with our stakeholders. I think it was really the role of the working group that came into its own at that point, because our working group members were excellent at linking with local people, local volunteers, trying to get them engaged. Our Links Eyemouth group on Facebook were really good in promoting the whole systems approach work as well. We had a press release in the Berwickshire News that gained a bit of coverage. We tried to get information onto all of the local social media pages. There are quite a few in Eyemouth, and you know, having our colleague working in Splash for Community Trust, she was able to share things which other groups were then able to share to other pages. So we did get pretty good coverage. Digital inclusion, as mentioned, there was work ongoing around making sure that people had access to tablets and the tech that they needed. And then, as I say, there was that issue around, is it MS Teams, is it Zoom? But I think probably you just have to go with, you know, obviously what your guidelines are for the organisations that you work for. The system network. So really, we had a 3rd workshop, which was really our system network starting to come together, where they consolidated the draft action plan. So what we had. And really after workshop 3, we still really had our 3 themes. We weren't really able to pull together sort of tangible actions from that. And certainly, you know, because we're working with community groups and community members, it was quite difficult to get people to take a lead, especially when they didn't really kind of know what the tangible actions were at that point. And again, that was done on MS Teams. So our level of engagement has kind of dropped as part of the online sessions, but what I would say is that you know, we're still having quite a lot of individual email contact with people. We are having a lot of conversations that are happening at the community level. So you know, it's just different to maybe what we would have envisaged at the onset. We now have subgroup meetings and to define the action plan. So I think the next slide is just really to give you just an overview of what our structure looks like at the minute in terms of our action planning. So we have we obviously have our governance group and then our working group that's set above this, but then we have our system network. So the 3 priority themes were communication, family participation and learning, and outdoor activities. So we, once we'd had our 3rd workshop, which was our sort of first of our sort of system network meetings, we then split it into the 3 themes to try and sort of really sort of refine what those actions would be, and that's what we've been doing. So our working group meetings are weekly, so we've been really sort of working quite hard to get to this point. Our smaller subgroups have been meeting sort of every 2 weeks. For a couple of meetings we've moved that to every 3 weeks. And then we have smaller action groups that are working across the 8 actions that you can see there. So our Eyemouth Living publication, because the communication came out as part of the work that we did, the first publication, which will be an A5 booklet that will be delivered to households in Eyemouth, will be delivered in December. That's going to give us a really good start on getting that information out to all community members about whole systems approach and include all of the information about the other actions there. And there's a range of different things. So we've got book boxes that'll be put in places that can be accessed by families. So maybe a couple of the cafes, the community centres, where the focus on health and wellbeing. Play spaces, what we're looking at doing there is a community engagement with families to try and find out what could be done to improve existing play spaces. There's a community coordinated lunch, which has been talked about for quite some time. We've got a visual map so really that was about trying to see what are the assets that are already existing in Eyemouth that support health and wellbeing. We've engaged the local geography department at the high school, who are going to do a mapping with one of the classes. And then you can see for the outdoor activities, we've got a junior park run, cycling and outdoor activities. I think my 3 top tips are really have a good think about your working group representation and how often you meet. Regular engagement with your stakeholders. We've got another system network meeting in December, and having a supportive and responsive governance group. Apologies if I've run over time there, David, and that's me finished. Thank you very much for listening.
Not at all. That was great. Thanks, Penny. Really, really interesting to hear, particularly how you've adapted to some of the digital working in response to COVID, but also really encouraging to see the action map, and many of your current actions are more upstream than downstream. Okay, we're just over halfway through, so if anyone wants to stand up and stretch, I encourage you to do that. And let's move on to our next speakers. So we have Jenny Gillespie, who's a Senior Health Promotion Officer in Dundee, and Caitlyn Kydd, who's a nutrition student at Robert Gordon University, who's currently on a placement with NHS Tayside. Thank you.
So so good morning, everybody. I'm actually really delighted to be here to share our experiences from Dundee. So thanks to David for the introductions, and also to the organisers, Obesity Action Scotland, for inviting me along. It's really great for us to follow on from our fellow East Coasters, and I'm going to be representing Dundee's core working group today. So my name's Jenny Gillespie. I'm a Senior Health Promotion Officer and a Child Healthy Weight Dietitian in NHS Tayside. And I am delighted and proud that I've also got Caitlyn Kydd, who's a student with us at the moment, who's going to also support me in this presentation. So I'll maybe just let Caitlyn introduce herself briefly before I move on to the presentation.
Hi everyone, so like Jenny said, I'm a student from RGU in Aberdeen and I study food nutrition and human health. It's actually a relatively new course and I am part of the first cohort to go through the whole process, so that is quite exciting. I would really just like to thank Jenny for giving me the opportunity to present with her today and for trusting me with the job of doing that. So yeah, that was just a little bit about me, and I will speak to you guys about the work that I've been doing on the website at the end of Jenny's presentation.
Excellent, thanks so much, Caitlyn. Okay, so before we move through the slides then, I guess what we're really, I'm hoping to achieve in this presentation is to describe our processes in moving and adapting from the photographs that you can see on the left-hand side of my screen, where we all used to sit round tables face to face and be able to use post-it notes, very tactile, or even use the Ketso tool, which is a really engaging tool to use as well. That's a picture of some young people in Dundee. To move into what we're now more used to and familiar with, which is engaging online. So really this slide is just really highlighting what we're going to cover this morning. I'm going to set the scene a little bit about Dundee, just as some of our previous presenters have as well. Dundee is known as the city of discovery, and I like to think of our approach as being a little bit of a voyage of discovery in itself as well. I'm going to then move on to share some of our experiences in adapting to an online environment and summarise some of the key reflections and top tips before I pass over to Caitlyn, who is going to look at our website. So here in Dundee, we are embarking on a whole systems approach to diet and healthy weight. And what's maybe different about our approach is that we're looking at this through the lens of children and young people's well-being. And this very much aligns with the Scottish Government's ambitious target to halve childhood obesity by 2030. Really what we're looking to do is to try and address some of the health-related inequalities. And one of those is the social inequality and obesity risk. And this is what we want to address. So we know that childhood obesity is a complex social issue and that requires a whole systems approach. The opportunity for us to be an early adopter site as part of the Scottish Government's test approaches came on the back of lots of ongoing work related to child healthy weight in Dundee. And three such examples I've put on this slide here. So on the left-hand side, you will see some of the work that we did that was published, which was with a specific community in the East End of Dundee, which was called the Eat, Play, Learn Well approach. There was also some designing healthy weight community events, and a lot of this work was due to the tireless efforts of our dietetic consultant in public health and nutrition, Joyce Thompson, who's now retired, but she had done a huge amount of work to do with this. We also did a lot of community consultation in 2019 so that we could sort of co-design and co-develop our child healthy weight strategy. And on the right hand side of the slide here, you can see my daughter Cara was at an event with me, and that again back in the day when we could actually go out and do face-to-face sort of summer fairs and engage with people really in the heart of their own community. So although there was no specific funding for any of these pieces of work, there was a growing appetite for the child healthy weight agenda in Dundee. We had gained traction and we had gained momentum. And that was at the point where we were then identified as one of the early adopter areas for a whole systems approach. So again, though there was no ring-fenced money specifically for the whole systems approach, wider child healthy weight money was available for us to utilise this test approach. And importantly, this approach came with the support from the National Coordinator in Obesity Action Scotland and Public Health Scotland. And the training package that's been mentioned a couple of times already this morning related to systems thinking and the use of the methodology from the Public Health England guide, which you can see here. And we were supported through training by Leeds Beckett University. So at the point of setting up and establishing our sort of whole systems approach in Dundee, pre-pandemic, 4 members of staff who work in Dundee, including myself, were put forward to attend the training. So the Public Health Whole Systems Approach Guide, and again this has been mentioned, centres around the 6 phases that you can see in front of you here. And it also has a huge range of supportive resources and materials that we can make use of to support each step in the process. Here in Dundee, we are actually at phase 4 in this process. And it's super useful that this toolkit has provided us with all the materials and resources. It was developed pre-pandemic, and so we had to adapt elements so that it could be adapted and to be most suitable for this digital world. So we did deviate slightly away from the process that you see in front of you. And sorry about the busyness of this slide, but it really does just sort of capture our journey so far. If I start on the left-hand side of the slide, just pre-pandemic, and we were able to have the training from Leeds Beckett University around about systems thinking, causal maps, and how to facilitate workshop 1, which is a key event within the methodology. So we were again face-to-face in Glasgow when we were able to do that. We attended these 2 training sessions, which were really, really helpful. And we were also delighted to have the support from our national coordinators at Obesity Action Scotland and Democratic Society, who actually enabled us to enhance some of the training that we'd had from Leeds Beckett University, and again gave us the sort of confidence to be able to deliver the workshop digitally as well. So that was really, really crucial. It helped us reframe really our way of thinking. and to have that confidence. So Obesity Action Scotland have been really helpful in terms of enabling us to have Skillshare events, which have been really critical for us as well, to understand how other teams have approached some of the challenges that are associated with this as well. And along the bottom, you can see how these tie in with the key phases that I'd highlighted on the previous stage. And although that I've tried to organise this and represent it in a linear time frame, really in reality the process is very iterative and dynamic. On the outskirts of the slide, you'll see some of the digital tools and platforms that we made use of in terms of delivering our workshops. I'll highlight just here the focus FGDs, focus group discussions that we added in as an extra step, and I'll go on to talk about these in a little bit more detail. So many of you will be familiar with some of these digital tools, but I'll highlight sort of Sway and Canva as being tools that we use to send out information in advance of our workshop events to stakeholders. We had Miro and Jamboard as sort of digital whiteboards that were very helpful in ensuring that our stakeholders were able to contribute at sort of breakout room sessions. And in terms of our systems mapping tools, we started off with a tool called Plectica and also then used Kumu latterly as well. Before I forget, I will just mention, and Niamh had already mentioned about evaluation, and we are fortunate in Dundee to have two sort of concurrent evaluations of our process going on at the moment as well. So next slide, if I can move on. Whoops. Sorry about that. There we go. So now go on to talk about each of the phases in a little bit more detail, and some of this will be a little bit of a whistle-stop tour because I'm aware of time as well. But phase one was really, a lot of this was done pre-pandemic, and the timescales are identified there. And the key steps in terms of the Public Health England guide that are crucial at this stage are highlighted on the slide here. In terms of our senior sponsorship of the approach, we were really lucky in that the Executive Director of Children and Families Service, Paul Clancy in Dundee, was championing our approach from the outset. And I do think that was made a little bit easier by the previous work that had been done to do with the Child Healthy Weight consultation, and also some of the work that we'd done in the East End of Dundee. And then crucially and importantly, obesity and reducing obesity was actually a priority identified within the Dundee City plan as well, so that was really crucial. The core working team is made up of myself, William Cook, who's the dietetic consultant in public health nutrition, and also Audrey White, who is based in Dundee City Council's Children and Family Services. The reason step 3 and 4 is sort of left in red there is that although these are quite crucial steps, I would say that we still have a little bit of work to do around about establishing the resource to support and sustain the approach moving forward, and also around about sort of some of the accountability and governance structures. I think that is something that we need to continue to work on. And I would also highlight that throughout all of our processes, we have been fortunate to have undergraduate students who have been supporting a lot of the work, and the whole systems approach methodology lends itself really well to student projects, or certainly that's been our experience. So moving on to phase 2, which is all about building the local picture. How was it that we were going to try and explain to our local stakeholders why obesity matters, and to try and create that shared understanding of how to address it? So this involved us collating local information and trying to understand our local assets. And on the left-hand side, these are just two examples of, I guess, tools that we use to enable that. Fran Eatwell Roberts, who was the current Obesity Action Scotland National Coordinator, had done a lot of work with Public Health Scotland to create this Story Maps website, which we used in the early stages. And I think, again, a learning from me is that that's something that we would really quite like to pick up because of the way that some of the data was presented. They just used something called GIS mapping, and it was really quite powerful and very helpful. And I think we maybe need to make better use of that. But we decided to also create our own website, and I'm not going to talk too much about it because Caitlyn is going to talk a little bit later about this, but it really did help us engage and communicate with our stakeholders. Okay, so moving on to phase 3, and this is actually a crucial step in the process, and going back to my very busy slide earlier on, the key event that takes place in the phase 3 is about this online workshop 1, which is about really understanding the causes of obesity and enabling our stakeholders to sort of create comprehensive maps of the local system. And remember that the Public Health England guide, whilst excellent, was created being able to do this in a face-to-face sort of environment. So we had to do sort of have a lot of consideration as to how we would engage our stakeholders with this. And what other colleagues have mentioned, that it's quite academic and the language used maybe doesn't quite land with some of our stakeholders. So what we found as core working group members was that we were really having to learn how to sort of steer the ship and navigate at the same time. We were having to learn how we might strip back a little bit some of the academic language to make that more appealing to our stakeholders. And that was quite tricky. We figured out early on that we probably wouldn't be delivering a sort of 4, 5, 6 hour event online. And just as Penny had highlighted earlier, I would highlight how much how important it was that we got support from our colleagues in Dundee City Council for tech and IT support. So we delivered our online workshop in December 2020 through MS Teams, and we had quite a successful event and 50 stakeholders attended. We used Plectica, you can see on the bottom left, for our mapping. So we had to train and support a huge number of facilitators to enable us to do smaller breakout room activities. And that's another thing just to highlight there about sort of the time that's required in that. And Jamboard, our digital whiteboard, was really useful to sort of capture our stakeholders' views on the causes of obesity. We used Mentimeter again to try and keep it interactive and engaging for our stakeholders. On the right-hand side, the star there is just again highlighting the critical step that we feel we introduced. It was a bit of a deviation away from the Public Health England guide. And we were really, it became apparent after workshop 1 in December that we really needed to allow a little bit more time in smaller groups to focus and have a bit more discussion to try and understand a little bit more of what our stakeholders were trying to tell us. So we did some small focus group discussions under 3 key themes, and we had a total of 24 participants taking place in those ones as well. So that then takes us to sort of around about now, that has been ongoing since March, and phase 4 is the action phase. And this is really around about, I guess the crucial element here is delivering workshop 2 as part of our methodology. So this is about bringing our stakeholders together to prioritise areas to intervene within the local system. The purpose really is to try and get some aligned actions through the delivery of workshop 2. And in the preparation for this, again, this was when we switched over from using Plectica. So we had managed to generate 9 causal maps, which were the outputs from workshop 1. And the focus group discussions had enabled us to also get some insight into current actions. What were the initiatives and the interventions that were happening on the ground in Dundee? And we were able to capture that, but moved all the data over to a tool called Kumu. I'm not sure if any of you are aware of this, but hopefully. So what I want to do then is just show you and highlight what we feel is one of the key learnings is that to enable our workshops to take place online in quite a short period of time, so for workshop 2, it was sort of like a 2-hour session, we realised that we would want to send our stakeholders some information in advance of the workshop, just to bring them up to speed with really what had happened in workshop 1 and our processes so far. So enabled to do this, we produced a short video, And the main content in the video was actually around one of the key concepts about in workshop 2, which is around about the action scales model. And that's really quite a tricky concept to grasp, and we've certainly found that, and I personally found that as well. So we produced a short video that enabled our stakeholders to take their time. So we sent this out maybe a week or 2 weeks before the workshop, and they could navigate this. And Kumu presentations, and I'll before I forget, I'll thank Niamh Smith, who's on the call today, for her excellent work in helping us produce this, and also a colleague, Lorna Murray in NHS Tayside as well, who supported us with. So what I'll just zoom in, I'll just talk about this very briefly, is to show you that our systems maps, we were able to then, from the focus group discussions, overlay some of the actions that people had told us about, our stakeholders had told us about. And you can see there that they were able to interact with this through the Kumu presentation. So I'll close that over. I just wanted to highlight that as being something that we found particularly useful. So in terms of workshop 2, we provided our stakeholders with a video. We provided them with some pre-information and in the form of a Kumu presentation that really summarised what our journey to date had been, and showed them our maps as well that they could interact with. And one of the crucial tools, I feel like, that we used during workshop 2 was Miro, which is also an interactive whiteboard. And I've just put a screenshot of that one there as well to enable us to facilitate the conversations and to get the detail from our stakeholders as well. And outputs from our workshop 2, at the moment, we're just very much in the process of that, and we're planning to do similar to after workshop 1. We introduced focus group discussions. We're actually at that stage now where we're going to do some focus group discussions based on the outputs from the breakout rooms and the Miro boards that were collated after workshop 2. So this week, actually, myself and Caitlyn are going out to do some focus group discussions with young people as well, because young people are really crucial, but we hadn't been able to join us at our workshop. And perhaps it wasn't maybe appropriate for them to join at that stage, but we're going to go out and do some smaller groups. So some of the actions that we've got coming out and the themes coming out at the moment that people and our stakeholders would really like us to take forward are linked to PE in schools, safer, greener spaces, community cooking, and sort of fast food outlets, and addressing the lunchtime experience for young people at schools. And really just to go back again a step and just to say that we've been really delighted to have been part of an evaluability assessment process with the Public Health Interventions Response Team, who are sort of doing a local evaluation of our approach in Dundee. And they've been able to engage with around 40 of our stakeholders online, again using MS Teams, to carry out these 3 sessions between May and October 2021. And what this has enabled is co-production of a draft logic model and some of the key evaluation questions that is going to inform really the most appropriate evaluation design of our approach moving forward. And we're just about to embark on some other national evaluation through Social Marketing Gateway that Niamh had mentioned earlier on as well. So just finally, before I hand over to Caitlyn, just some of the key reflections from Dundee were that we have been able to use a range of digital platforms. They've enabled us to facilitate engagement with our stakeholders. And some of my key top tips are around the side there. And I think it's really important to highlight some of these for anybody who's embarking on this approach. It's crucial that you allow yourself enough time to sort of understand things yourself before you're then in a position where you're going to be facilitating online. And you can read the rest yourself, but I will highlight this, that sometimes it does take a little bit of courage just to try new things and embrace things, because this is a different way of working. So sorry, a bit of a whistle stop tour, but I'm now going to stop sharing my screen and hand you over to Caitlyn, who is going to talk through our website that we've developed in the last wee while, and students have been really crucial in enabling that. So I'll stop sharing now. Thanks very much.
So I'm just going to do a quick tour of the website just to show what we've been doing. To start off, we have created this website through Google Sites. It was free to use and we could upload it and update it, all those types of things, just whenever and however we liked. Just a note at the top, the best way to view the website is through Chrome. Myself being a MacBook user, I found that when I use Safari, it sometimes caused the website to crash, so we would suggest for everyone to view it through Chrome. So getting started, so this homepage, these actions buttons here just correspond with the navigation bar at the top of the screen. And by clicking on these, we'll take you to a little contents page of what is included in each section. So for the Our Work section, I've just put a little explanation as to what to expect from each page. So the first one is information on what a whole systems approach is and Dundee's whole systems approach. Our second page has information on why we are using it, and we've also included some child health statistics. The third page is about our 10-year child healthy weight strategy and also includes the 5 ambitions that we hope will help to meet the target of halving childhood obesity by 2030. And then the last page is on our theory of change model, our eat, play and learn well approach, and why developing a shared vision of local factors affecting childhood obesity is important. So we've split up the website into each of the events. So workshop 1, I'll not go into too much detail as Jenny has quickly explained this already, but we had this on the 16th of December last year. And the main aim of this workshop was to bring our stakeholders together to create a map of the local system understood to cause obesity and begin to create our shared vision. We also have information on all the tasks and the outputs from workshop 1, and scrolling down a little further, we've included the agenda so you can see exactly what went on in the workshop as well. And then focus group discussions, which were held on the 31st of March. This was really to highlight the key points from 3 main topics. So these were education setting, play, physical activity and green space, and diet, cooking skills and planning and licensing. And then we also held a focus group discussion with 4 young people, and this one focused on the child healthy weight strategy and the 5 ambitions. And then workshop 2, we just had at this near the end of September. So this was actually just a couple of days after I started my placement, so it was kind of thrown in, but it was really good to experience. So again, we have listed what went on and the main aims and tasks of the workshop. And as Jenny said, we're currently planning our focus group discussions to start the week of the 22nd of November. So the outputs from those will be updated soon. And again, we have included the agenda as to what went on. So I'll just skip the next page as there's nothing there yet since we've not had the focus group discussions, but the action mapping and actions page, this is where we have put the outputs from focus group discussions 1, and I have got this in a separate tab here. So what we've done here is just a little summary of the results, and then these have been characterised on the wider determinants of health diagrams here. And what we plan to do is once we get back to processing the outputs of the second focus group discussions, we'll pop them up here too. The evaluation page, like Jenny has already mentioned, we're working with a group of researchers to assess the valuability of the approach. So that's just some information on that page there for you. And going into the next section, we have got a page on the team involved in this approach. So we've got our core working team of Audrey, Will and Jenny, and also all of the trainers, facilitators and lead sponsors as well. And then if you would like to contact us with any questions or if you'd like to get involved, you can email Jenny at this email address here, or you can contact us through Twitter at HealthyWeightD. Our latest news page, sorry, I realise I am going quite quick, but I know we're a bit short of time. Our latest news page is where we have posted our newsletters, and we've just finished designing the second one, so our autumn newsletter, and this one focuses on progressing the key ambitions of the Child Healthy Weight strategy, Dundee's whole systems approach, and the evaluation of that. And then we also have a page for frequently asked questions and a glossary for all the terms that we've used on the website with a little explanation just to make it a bit easier. So yeah, so that's just one way that we've moved to this approach being online, and it just helps us to communicate with our stakeholders and has all our information in one place. So that's that there. That's my little presentation.
Thank you, Caitlyn, and thank you, Jenny. That was fantastic. Really interesting to see. The website looks great, and yeah, great presentations. I'm keen to move on to the panel now. So we have around 10 minutes for Q&A. We've got some questions in already. So I will start things off, invite everyone back into the panel, but start things off with questions for our first speakers. And the first one, I'll do these two together. So the first question is for Laura and Holly. Have you made connections with the Air Cadets and Army Cadets in Musselburgh? Lots of local young people involved in those organisations who maybe don't know about the whole systems approach. And then I wonder if you could answer that one together with the question on the range of community groups you've managed to engage with. And could you give some examples if you might predict, for instance, that who you may be able to work together better with, or is it too early to think about that?
Holly, I could say a few words. I could give some examples of the sorts of communities that community groups we've engaged with. We're lucky that we've got a really wide variety, and some of the groups that we have engaged with are also really have good connections themselves, which will hopefully lead to more connections. So some examples would include the Rotary Club, we have the local football club, we have an art therapy group, a mental health project, and we also have some local businesses like the Business Gateway. In addition, we have some council-based stakeholders like the planning and licensing team who will be really important to helping us implement our plans as well.
We had reached out to the cadets as well, but we hadn't got a response from them. So maybe we need to kind of work on how we need to deliver that engagement. So thank you for that.
Okay, great, thanks both. I've got a question for Penny as well here about the junior park run that you mentioned. Is that through the national park run scheme, or is that a local response?
So junior parkrun, I think it's quite an interesting one, and I think it's something that the whole systems approach can really support with, because it's something that we've had a group of community members, they've tried to develop it over a number of years, but the issue for Eyemouth is that they don't have an actual park as such. So there is a piece of land that we've identified for junior parkrun. They don't have, they've worked with the national organisation in the past, they don't have a route, a 5k route for a parkrun that would be a safe route to use. But we think that we do have a junior parkrun route, which is 2 kilometres. There are conversations ongoing at the minute about trying to gain permission to use that land. It has been earmarked for development, so we're working with our council partners. But hopefully, I think that's where the whole systems approach will come into its own, with projects like Junior Parkrun, where there's a real community want to see that happen.
Great, thanks, Penny. I've got a couple of general questions, so can take it in turns to see who wants to step in. The first is whether there's a general consensus about whether online engagement has helped to engage with some stakeholders, and which stakeholders conversely might have been unable to participate as much as they would have with in-person opportunities. So I don't know, maybe Jenny or Caitlyn, do you want to pick up that, and then we can get comments from others as well?
Sure, yeah, thanks, David. I mean, I think it's a really good question, and it's probably something that we've all been grappling with over the last couple of years, is to trying to strike that balance, right? I mean, we've had to do it this way because of the pandemic, but we are very aware that perhaps that is not enabling many of our community members, for example, to be able to join some of the workshops. So what we've found we've had to do to try and counter that is really work hard at trying to engage some of the community-based workers who can perhaps express things on behalf of community members to enable them. At one of our events, it was linked with the Child Healthy Weight strategy rather than the whole systems approach, but sometimes it's the same stakeholders who we have attending. We'd actually had a community worker who was going to screen our workshop in a community hall to enable local people to come along to sort of view that and to contribute that way. So that was a really nice idea. Unfortunately, the said community worker was struck down with COVID a couple of days before, after all the COVID sort of protocols and things have been followed. So unfortunately that couldn't go ahead, but I suppose it is something we've been definitely trying to do. In terms of those who have engaged and the positives that have come out of that, in that I guess some of our stakeholders from across the city may not necessarily live within the city. So I guess from that point of view, on a practical level, being able to come in to an online event has been quite useful. But yeah, definitely something that I would say is we've all been sort of grappling with. Don't know if anybody else wants to share.
I think just to come in there, I think from our perspective, we were really trying to engage with parents, a lot of young children, because of the links that we had and the focus of our whole systems approach. But usually, sort of in a non-COVID world, we would be in the community centre. We would have a creche that would be available so that parents could engage while the children were in creche. So it was quite difficult, and we did do a couple of sort of follow-up sessions with groups of parents online, just smaller focus groups. But in terms of the geography for Eyemouth, because it's so sort of rural and sort of there's quite a distance between sort of central borders and Eyemouth, I think the virtual delivery also helped with some of our other stakeholders to attend, because it just would be, the distance would be quite a challenge.
Yep, no, thanks, Penny. So kind of pros and cons coming through there. I've got another couple of questions. One, does anyone have any community food growing projects being evaluated?
We don't have any, unfortunately.
Nope.
That sounds really good, though.
We've certainly got a lot of or a number of food growing projects that are identified as actions within our whole system and are represented on our map, and they're very much at the heart of a lot of the community work that's going on. And so yes, they feature because we're aware that how important they are.
Okay. And any governance update on performance impact so far? Might be too early to say, but
I think we're at the very early stages of our project, so we're not quite there yet. But we can really understand why that is such an important process to go through properly, and must be really helpful as well. But we're not quite there yet, unfortunately.
Yeah, similar to Holly, I think this is sort of a marathon, not a sprint. And I think the reality is that it's going to be maybe 5-10 years time before we really know the impact. However, the process that we're involved in is key, and actually evaluating that process is part of the national evaluation. So I think it'd be really interesting, and before too long, I think we would be starting to see some outputs from that that evaluation.
okay, so questions coming in thick and fast now. We might not manage to get through them all. I mean, I guess one straightforward one that Niamh, you might be able to answer is a practical one. Will contact details of the panel be available if anyone wants to follow up with specific panel members?
That's a good question. I'm sure panel members would be quite happy to have maybe just get a wee nod or their contact details shared, and we will be sending out a survey just asking for feedback on the webinar, so perhaps we could add some contact details and links to some of the websites and different things that have been shared today as well. That could be useful.
Yeah, great. Okay, let's go for this one. So any tips for the action planning stage? The action scales model looks very complex. Who wants to take that?
I'm happy to give my perspective on that,
Thanks, Jenny.
and agree wholeheartedly with the notion that that is quite complex. Indeed, it is. But I think for me, I think one of my top tips was around about allowing yourself the time to sort of understand that yourself, and then be able to try and I suppose drill it down a little bit and identify the key points. And just on a practical point of view, we felt it most appropriate to create a short video to break that down into bite-sized chunks and to try and visualize it a little bit, because it's quite a visual element. So yes, really tricky. I'm more than happy to share our experiences in a bit more detail in terms of Dundee and how we did that and some of the practical things that we found helpful. And just to reassure people also that some of the feedback that we got from our stakeholders was actually following on from our workshop too, where we addressed that sort of the action scales model element of that. There was almost this, a lot of our stakeholders said to us, I think we're getting this now. This is, we're starting to understand this, and we're starting to understand that process. So that reassured us a little bit that, you know, at least for some of our stakeholders, we feel that we probably managed to do what we achieved there.
Thanks, Jenny. Anyone want to follow up on that, add anything?
Just to come in there, Dundee, I was at Dundee's second workshop, and they did a really great job of going through some actions that exist and kind of talking about how they sit within the action scales model and that type of thing. So providing examples that people can relate to, I think, was a really useful thing that Dundee achieved.
And I've got a kind of related question, which was about whether or not you have a feel for what sorts of activities are most readily embraced by the communities that you're engaging with, and also whether or not that's changed since COVID with people, you know, more engaging online.
I think that's a really, really interesting question, and I think there seems to be a bit of a need for people to be together now in a way that we weren't able to be for a really long time, and even the most introverted person needs to feel involved in a community, and I think you can't always please everyone. Yeah, it's just one of those things, and sometimes I think it's having a range of activities, because there's some already great ones where it is online, some like mental health support for like men in the community. It's just on Zoom because it's easier for them to not be in person but to talk about things online, whereas for some people it's really important that you have that physical engagement and look each other in the eye, and I think sometimes it's just having a combination of the both, and trying to find out what is the kind of the specific audience that they're trying to work with, and what do they need. But I think there's a real kind of want for people to be together now, which is really nice.
Great, thanks, Holly. We've just got a couple of minutes left, so I'm going to use the chair's privilege to ask the last question, and it was picking up on something that that you'd said, Penny, about the financial inclusion connections, and clearly, you know, I think every speaker has flagged the inequalities dimensions of diet and healthy weight, and I wondered if you could say a little bit more about that.
In terms of the, was that the comment about the when we did the mapping of activity? in the early sort of stages of our whole systems approach, and there was just some people that really they were interested and they were on board, but maybe couldn't quite see the connection between the service that they were offering and what we were trying to achieve in terms of supporting healthy weight, eating well and being physically active. So yeah, I think you know, there was follow-up conversations that were happening, and it was probably quite timely in because at that time and since our department have been developing a Money Worries app. So my colleague has been leading a piece of work where they've developed the app, and has, you know, she's been linking with local stakeholders around sort of financial inclusion. So the whole systems approach work just seemed to kind of fit quite nicely alongside that, and so she was able to kind of have those conversations and really make the connections just through that work that was also happening. I don't know if that sort of answers it, David, but
yeah, no, I guess just struck by how important that is to make access to welfare advice more accessible and part of this this conversation as well. Super. Well, I think that's about all we've got time for, I'm afraid. I just want to thank the audience, thank all the fantastic speakers and panel members today. Thanks to Niamh and the others within the Obesity Action Scotland for organising today's webinar. Anything else, Niamh, from your point of view? No. Okay. Thanks, everyone.